Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, friends. Welcome back to this week's episode of the Healing Pain Podcast. I am your host, Dr. Joe Tatta. It's great to be back with you. I've taken a couple weeks off to enjoy the summer fun, the summer sun. I spent time in Florida with some family, enjoyed some of the beaches here on Long Island in New York, and spent some time up in the mountains in Connecticut to get away from the heat of the city. But I'm excited to be back with you this week, sharing ways we can safely and effectively treat many different types of chronic pain conditions. This week, we are focusing in on neuropathy, also known as peripheral neuropathy, which is the result of damage to nerves often located outside of the brain and the spinal cord. Symptoms of neuropathy often include persistent long-term pain, a sensation of pins and needles, numbness, as well as weakness. One common cause of neuropathy is diabetes, but it can also result from an injury, an infection, or even exposure to a toxin. Although there are conventional treatments available, these often only mask the symptoms and do not address the root cause of the condition. However, integrative and lifestyle medicine approaches for the treatment of neuropathy are becoming more popular, with a strong evidence base to support their use in a wide variety of patients and populations. Joining us this week as our expert guest is Dr. Heather Carlyle. Heather is a physical therapist who specializes in treating neuropathy in both people with diabetic neuropathy as well as those with chemo-induced neuropathy. Dr. Carlyle graduated with her doctorate degree in physical therapy from Emory University in 2007. She's been in practice for over 15 years and has worked with a variety of chronic pain conditions with the aim to restore function as well as manage and alleviate pain. About 7 years ago, Heather discovered a passion for helping people live a more natural lifestyle that focused on restoring health and wellness, as well as improving overall quality of life. This led to the use of natural and integrative approaches to support and provide the body with the tools it needs to heal. Dr. Carlyle is the creator of the Path to Less Nerve Pain, which is a hybrid online health education program that she developed to treat and reverse neuropathy. Dr. Carlyle is also a fellow of the Integrative Pain Science Institute, having completed the Pain Innovator Project, and much of the information she discusses today was part of her work in developing her program or her product, which is the Path to Less Nerve Pain. If you're interested in the Pain Innovator Project and becoming a fellow of the Integrative Pain Science Institute and developing your own protocol or method, as Dr. Carlyle did, you can head on over to the Integrative Pain Science Institute.com website, head on over to our courses and over to the tab, look for the Pain Innovator Project, or you can just send us an email at support@integrativePainScienceInstitute.com. That email is support@integrativePainScienceInstitute.com. On today's episode, Dr. Carlyle will discuss the different components to the path to less nerve pain. You also learn what causes neuropathy, as well as the various traditional, as well as complementary, alternative, and integrative medicine approaches that can be used for its treatment. Okay, without further ado, let's begin and let's learn about the path to less nerve pain and how to reverse peripheral neuropathy with Dr. Heather Carlyle. Hey there, Heather. Thanks for joining us this week. It's great to have you here.
Thanks, Joe. It's great to be here.
I'm excited to chat with you this week. Obviously, you are a physical therapist.
Mm-hmm.
You have your own private practice in Georgia.
Yeah.
And you've started to really build out this interesting niche in your private practice, which I really have found few physical therapists who have really started to niche into this topic, as well as seeing the general neurologic and musculoskeletal pain that all of us see. But you've started to niche into neuropathy and neuropathic pain, which is such an important component of looking at people with pain, right? Because we hear these numbers all the time. There's 100 million people who struggle with chronic pain, but within that 100 million people, there are the population of people who have fibromyalgia, and there are populations of people who have chronic low back pain, and then there are people with neuropathy. How did you decide to focus on this niche in your practice in particular?
It was kind of a natural career progression, Joe. So I spent the early part of my career really in orthopedics and neuro inpatient rehab, where I was working with a lot of different patients, a lot of them that were struggling in that kind of chronic pain world. And, you kind of become intrigued as to why some patients develop chronic pain and neuropathy and others don't. And then within that kind of subset that do, trying to figure out why it's so difficult to treat. They don't respond well a lot of times to our more traditional methods. And I could really see their frustration. They felt like they didn't have a lot of support. They didn't have a lot of options. I felt my own frustration as a clinician because they didn't respond to a lot of the more traditional treatments that we typically use. And I knew there had to be a better way that we could help them. So you talked to kind of that big group of chronic pain, and within neuropathy, there's 20 million of that 100 million are adults struggling with some sort of neuropathic pain. And so you realize just how many people need that kind of support. And then I kind of had a personal factor. So my own dad is type 2 diabetic, has been for a long time. And around this time is when he really started to get that neuropathy that comes from having diabetes. And I saw his personal struggle, right? Not having a lot of options, not really responding well to the medications. I saw how it affected him on a mental and emotional level when it impacted his ability to participate with his kids, his grandkids, to go out, to do his job. So I knew there had to be a missing piece. There had to be something we were missing in that bigger treatment puzzle that just wasn't happening for these patients, right? And so that's when I started doing some deeper dives. I really started, studying and learning to understand neuropathy, what causes it. I realized that there were some integrative pieces I was missing. So, I have dove down into kind of learning more about supplements and essential oils, took the nutrition course, that functional nutrition for pain course that you offer, and started really looking for a way to tie all of this together so that it would make sense for the patients and the clients that I work with, and it would be simple enough for them to implement and still be able to have that bigger impact on how they feel.
It's interesting because as you're talking, I'm thinking back to, my early career where I worked in an inpatient adult rehabilitation setting. And I saw patients with neuropathy, of course, as every PT does. It sounds like you did as well. But we see them almost toward the end of their journey, so to speak, where there are already so many significant impairments present that it's very difficult to address everything that's happening at that point. But what you're saying is you started to look upstream and say, okay, I'm seeing this in my patients, obviously. I'm seeing this in a family member. How do I start? What am I missing? What are we all missing, so to speak? And how do I start to address this, obviously early on before we have people that are impacted with disability physically as well as emotionally? Talk to that impact a little bit more about how neuropathy impacts one's quality of life and function.
Oh my goodness. You're right. So normally as a physical therapist, we aren't seeing these patients until they're finally just telling their doctor they can't live, they can't do this anymore, right? They're getting to that desperate point where it's just incredible on their quality of life. So diagnosis of peripheral neuropathy really has a profound impact on quality of life for patients. And obviously, neuropathy is different for everybody. Some people it's more feet, more hands, like there's different areas that get impacted. But what we see kind of, I think, as a profession is that, we're looking at it, how does it affect fine motor skills? So doing simple things like being able to button up a shirt or being able to hold a pen and write. Doing meal and food prep can be a huge one. And then on kind of that gross motor, bigger kind of muscle, realm, we see things like it's impairing their ability to stand for any length of time, their ability to walk any length of distance. And sometimes because of the neuropathy, it impairs their, kind of that sensory input. It impairs their balance. So we've got increased risk of falls, which of course can lead to other injuries. And so what all those things combine to do is really impact how they are able to perform their work duties. It impacts how they can perform at home, doing just their simple ADLs, self-care. And that's kind of, as a PT, that's a lot of what we look at. But what we also see long-term is that these patients end up having the mental and emotional, that psychosocial kind of impact as well. So it leads to feeling frustrated. They end up feeling very hopeless. A lot of, patients in the chronic pain world, the neuropathy is no different. They end up also having chronic anxiety and depression. They end up feeling very isolated because as this progression happens with the neuropathy, many of them lose their ability to drive, or they're not comfortable driving. They feel very dependent on other people. They can't get out with family and friends and do the activities and the things that they really enjoy to do. And they kind of collapse inward. Their world kind of collapses and that quality of life goes down. And, we tend to address those physical things, right? The fine motor and the gross motor and the balance, but very little is actually being done, I think, to address kind of these psychosocial impacts, right? The emotional, the mental, and how it's impacting just how they view their quality of life.
The driving piece was really impactful for me because I had this image of obviously someone who has potentially neuropathy in their hands and feet. Mm-hmm. And when you have neuropathy in your hands and feet, you can't feel, right? Your sensation is diminished. So you can't feel the steering wheel in your hands.
Right.
You can't feel the accelerator or the brake pedal.
Right.
So there is a physical limitation or impairment that's there. But also when we think of driving, it in many ways takes away someone's independence.
Right. That's our freedom, right? That's our independence, especially I think in, America, because we don't have the transit systems like you see in other countries, right? Yeah. So, the hardest, working with geriatric populations or anything like that, the hardest thing to do is take someone's keys, right? They lose that ability to drive. And that's such an impact on their independence. And it does something, to like your whole outlook. It puts them at, if they do drive, they're at an increased risk of, getting to an accident or, causing injury. And so a lot of times people, because we live so spread out now too, right? We don't always have close family nearby. And so a lot of these patients need to get to doctor's appointments. They need to be able to get to pick up prescriptions and groceries. And all of a sudden they don't have somebody who can drive them, or they don't like asking someone, to have to drive them. And so they end up in this very difficult position where they can't get what they need to sometimes.
So you mentioned earlier a link between diabetes and neuropathy. Mm-hmm. Maybe you can just talk about that for a moment, but there are also other causes of neuropathy that I know you treat, which are important for us to share with our community as well.
Right. Yeah. I mean, neuropathy is kind of a broad term, right, Joe? Like we say neuropathy, but we see neuropathy within diagnoses. So, diagnoses, conditions, and the symptoms, even within that, the symptoms can be very variable. So, it's very hard sometimes when you're talking to people about neuropathy, because you're going to have patients coming to you with neuropathy that have intense pain and hypersensitivity. You may have some that are coming in that can't feel their hands and feet at all, or they're just numb and tingly. And there's kind of this broad spectrum of everything in between, burning, shooting pains, like you hear the gamut. And while the diabetes mellitus is probably one of the most well-known and major cause of neuropathy, right? We're seeing it more and more in cancer survivors. So after people go through their chemo and radiation treatments, several of the different drugs that they use are well known for causing neuropathy. So I'm seeing more and more of these kind of chemo-induced peripheral neuropathy patients as well. But kind of the underlying thing here is that there can also be toxin exposure, just like there's in chemo. It can be very inflammatory in nature. There's genetic pieces to it, right? There's multiple things that can go in and cause somebody to develop the neuropathy type symptoms. And what I've kind of found is this underlying theme where whether it's an injury, we see in CRPS, we see kind of this, even sometimes a minor injury that flares into this major neurological kind of presentation. But there seems to be this underlying root cause of inflammation in a lot of these clients, whether it was an injury or compression of the nerve, whether it's because there's poor blood sugar regulation or there's poor circulation to the area. It may have been, like I said, a toxin exposure. All of these things kind of have this inflammatory base. And a lot of times when I'm talking to people, they think inflammation is redness, swelling, pain, like what we see when you sprain an ankle or, get an injury. And while that is inflammation, that's kind of that immediate response, right? And as you know, that chronic inflammation can look really, really different. It can affect the whole body. It affects multiple systems. And that nerve system is just one of the systems that gets impacted. And the way that it kind of tells us that it's being hurt by this inflammation is these neuropathy symptoms. So we kind of have to factor in, well, what plays into inflammation, right? That's where we factor in these things like, well, is there nutrition? Is it gut health? Is it our quality of sleep? Is it our ability to be mindful and manage stress? Is it the exercise, either sometimes too much or too little? And so inflammation is very multifactorial, which makes neuropathy very multifactorial. So there's a lot of things beyond just, we think diabetes, well, they just need to regulate blood sugar. And it's so much more than just having good blood sugar control, right?
So from the diabetic side, there's an inflammatory component there, obviously related to diet and lifestyle.
Mm-hmm. Yep.
And then from the chemo-induced side, the drugs that are life-saving for people sometimes have negative side effects that can cause injury and inflammation to the nervous system.
Absolutely, because they're toxins, right? And so they're toxins to the cells that we want to eradicate, but that doesn't mean that they're not toxic to the cells that, we want to remain, right? So it's just there's that toxicity also creates kind of an inflammatory response in the body, right? Your body's trying to figure out what to do with it. And so it's trying to heal and recover from this, toxic blast that the body received usually. So yeah, there's both.
So you started treating patients, obviously. You've started doing your own research in this area, looking at the evidence behind integrative strategies or integrative approaches to treating neuropathy. How have you now built this into your own program, and what does that program look like?
Okay. So to kind of understand integrative, you kind of have to understand traditional a little bit, right? So like we kind of mentioned earlier, when it comes to treating neuropathy, the kind of more traditional means to do this has been mostly medication. So a lot of physicians, that's the first thing they turn to when that patient comes in and is complaining of neuropathy symptoms. And it could be pain medication. It's the neurological medications like your gabapentins and things like that as well. Sometimes they're using anti-anxiety or antidepressant medications. But a lot of physicians don't even turn to physical therapy right out of the gate. As we talked about, by the time they get to physical therapy, it's because other things have failed a lot of times. So we kind of have this traditional model of medication first, and then if that doesn't work, we move into physical therapy. And then the traditional way in physical therapy that we treat it is kind of through our modalities, our ice, our heat, our TENS. We use a lot of just balance retraining, strengthening, stretching, manual techniques. But the problem with that was that our patients are still really lacking access to that more integrative type approach, right? The nutrition, the lifestyle modification and interventions. And like you said, there's a lot of research coming out. They've actually done a huge amount of research, especially with the diabetic population, that really shows the benefits of lifestyle modification. So when I was doing this research, even there's even some research coming out now with the post-cancer treatment patient for lifestyle modification. And what they're showing is that when you combine things like self-management, self-education, and these lifestyle modifications, it starts to put the power back in the hands of the patient to make better choices, to kind of make these shifts. And with that comes that more patient-centered approach, which is what we're all taught to do, right? This patient-centered approach to how we treat. And so it puts the patient in a more empowered and active role into the decision-making process. And that ultimately can just increase quality of life before we've even really touched symptoms, right? They feel more empowered and in control. So what I kind of started looking at doing is taking that research and understanding the different components and creating a more integrative approach to how I'm treating neuropathy. So I can still bring in that conventional kind of physical therapy approach, right? Where we still work on strength and we still work on balance and we still work on like desensitization or depending on what the patient's needs are. But I wanted to be able to reach just beyond where I am in Georgia. And so I created an online platform. And that online platform is really just about that education and self-management piece. So it's this integrative approach where I break it down so that we are addressing nutrition and, talking about the importance of blood sugar regulation and hydration. We're able to address mindfulness and stress management techniques and, work on sleep hygiene routines that will improve overall sleep. And so I took that traditional PT with those integrative approaches. We include, education on supplements and essential oils as well, since I have that background. And we work on having the patient take control of that education and those healthy habits to make them more sustainable. And then we also added in some one-on-one, coaching and accountability and a peer support group, because everyone kind of needs to feel like they're not isolated and alone in this journey. And it always amazes me in the peer support group, like how much they can really help each other, right? And they can kind of even problem solve as a group through obstacles and things that someone might be struggling with. And so what it does is this combination kind of allows patients to improve their outcomes, their quality of life. It allows for more effective self-management and kind of a long-term shift, right? It's not just an immediate 12 weeks. This goes way beyond into now the choices that they're making, their lifestyle habits. So it's also just benefiting their overall health and wellness, not just improving the neuropathy symptoms.
So what you created was an integrative physical therapy approach to treating neuropathy. Obviously, you have a practice so people can come into your clinic and see you one-on-one. But as you mentioned, many people with chronic pain syndrome, especially neuropathy, are somewhat isolated at home. So the online component bridges that gap where if you can only see someone, let's say once in the clinic, let's say, the online component, obviously you can reach people from a further distance. Right. And obviously with that online component, they have the information and knowledge in front of them so they can learn on their own as they're going through the program. And then the peer support part, I think, is really interesting and so important because people do feel like I have this condition. I haven't been able to find a solution for it. No one's been able to help me. And then I start to feel alone. And many people are alone at home, right?
Yes. Yeah. Because again, we're talking about they tend to be more isolated, right? And a lot of people, they just not knowing other people are going through it. There's always something in peer support when you can be in a group where other people are going through it with you, right? And you can kind of have that support that, you're going to have good days and you're going to have bad days. And you've got people to reach out to when you're struggling and they're going to be encouraging and lifting. Like we're really not meant to live in isolation as human beings, right? We don't thrive well when we don't have a community. And so this is just one more way to give them that community. And it also allows them to go back over and over because these are things that sometimes they need to hear more than once. And so, I don't have to repeat it over and over again. This is something that's at their fingertips. And, then I get to focus more on working them through their different levels of making change, right? So they've got the education and that allows my time to be spent on helping them move through obstacles. Let's overcome blocks, let's customize, let's make this something that's very doable for them. So they have that base of education and then that coaching and support comes in so that they can make real progress and know how to implement that education and know how to move forward when they get stuck, because everyone's going to get stuck at some point. Right. So
I know you're obviously working with patients actively now. Can you give us maybe a case study or a patient example of someone who you've treated and has, what they were like when they came into the program and what they were like when they completed the program?
Absolutely. So I'm really excited for the results that I've been seeing. So I do have one client who gave me permission to use her treatment as a case study, which is super exciting. So she has actually completed the online piece of the program and the coaching. She's still in the group. But she was, it's a female who has undergone cancer treatments twice. So she was diagnosed with her first round of cancer, I believe back in 2017, 2018, went through cancer treatments, developed neuropathy with that chemo and radiation, and then has had a second round of cancer, unfortunately, that came and was diagnosed last year. And so she's gone through now breast cancer treatment, all the chemo and radiation associated with that. And it took the neuropathy that was already there. And of course, it just kind of exploded and it got worse. Right. And so she found me through another colleague who had heard what I was working on. And so, we decided she was a good fit for the program. And she came into the program a couple of months ago, and it was primarily her feet. So chemo-induced neuropathy, we see the feet being the most affected, but she also had some in her fingertips. But she was at about an 8 or 9 out of 10 pain pretty consistently. So very hypersensitive, couldn't wear socks, didn't like the sheets touching her feet, but still had to have something on her feet, could not walk across the floor barefoot. She just couldn't stand that input coming from the feet. She'd stopped driving, like we talked about, right? She didn't feel comfortable driving. So she was feeling very isolated. She does have family, at least in the area, but she had gone from being very active to, she's gone through the chemo, which takes a lot out of you, neuropathy aside, right? They're still recovering in so many ways after that, to having this pain that it was waking her up at night. Like she wasn't sleeping. And we all know, like, when you don't sleep well, your ability to manage stress and stay healthy is really impaired. So she was super excited. She came into the program. She has done amazing in the program. She's been very on top of it, very dedicated, very committed. And about halfway through our program, so around that 5-6 week mark, we had one of our calls, and we had already taken her pain down from a 9 to about a 4, a 4 or 5. And so just within that short period of time, she was already seeing improvement. And so when she finished the course, we had her pain down to about a 3 pain-wise. Now, she still had some tingling and numbness and things like that going on, but the pain was so much better that she was starting to be more active again. She was starting to sleep better. Right out of the gate, she said how much her energy was improving. And then she called me. She had a follow-up with one of her physicians, toward the end of the program. And the doctor looked at her and said, "I don't know what you're doing, but your lab work looks incredible. Just keep doing it." So it was kind of very comprehensive that everything, all ships rise, right? You start really focusing on health and everything improves. And so she is actually in my clinic this week, and we do an in-house Calmare Scrambler treatment with a lot of my neuropathy clients. And so she had finished all the online stuff, so she was able to come in this week. So we are actually running her through that treatment protocol this week. Yesterday was her first day. And just yesterday, she had a significant decrease in the tingling because she really came in. There was no pain. She's like, but I still just had that kind of tingly numbness feeling, not bad. She could feel her feet, but it was just there. And so even the first day, we saw a reduction. So she's super excited just to be able to, especially cancer survivors, they just want to put this behind them, right? They want to be able to kind of move through and past and not be reminded of everything that they went through. So I'm really excited. I'm going to hopefully be submitting her case study for publication, once we finish everything, because I think it was just such a great example of how that integrative approach can not only help the neuropathy, but just helps the health and wellness in general.
Yeah. So obviously her pain significantly decreased, which is always nice. Patients always would like that. And we like that too.
Right.
You mentioned changes in biomarkers, which I think are really interesting. And I hope you obviously track those, because it's always nice to see that as someone's pain is changing, biomarkers are changing. And as you mentioned, physical function is changing, right? So
right. Blood pressure is better, everything's just kind of looking a little more where we want it to be, right?
When the physician says, "I don't know what you're doing, but keep doing it," that you've touched on something special, right? Because so often they're seeing these patients that are, like you said, just taking the medication, maybe doing some traditional stuff. And what happens is there's a plateau, right? Nothing changes. But a lot of the solutions that you're working on, these integrative strategies, take it a step further. And since this is not happening in traditional medicine, you always hear, I don't know what you're doing, but keep doing it.
Keep doing it, right?
We always say, well, let me tell you what we're doing. Actually, I have this program, and you haven't told us the name of the program, so you should tell our community and the people listening the name of the program.
Right. So the name of the program is very simple. It's the Path to Less Nerve Pain. So, and I kind of did it that way because we know it's not a magic wand, right? Nothing really ever is. It's not the magic wand or the magic pill, because it is a journey for these patients and clients that I work with, right? I tell them all the time, the success is not linear. I don't expect every day to be just, 10 times better than the day before. It's still going to have ups and downs in the process. Because especially if you're working with clients that have had neuropathy for years, or have neuropathy due to something like diabetes, where the damage was done well before the neuropathy started. Most people, by the time the neuropathy starts, they've been diabetic for several years, and the damage has just kind of accumulated. And so I'm like, it didn't happen overnight. It's not going to go away overnight, but you're going to make steady progress in the right direction. And so it really is a path. It's a journey. So the Path to Less Nerve Pain is the program. And then the clinic that I have here in Georgia is Healing Essentials Physical Therapy. So they just are kind of cohesive and go hand in hand. It's done through, the program's done through the clinic. So
we'll link to the program and of course, Heather's website, healingessentialspt.com. You can find all those links on the show notes at the Integrative Pain Science Institute.com. But I've been following you on Instagram a little bit and watching you kind of grow this platform. And you said something a couple of days ago, which I think is really important for people to hear, because many people have been struggling with neuropathy for a long time, and they feel like, oh, I've had this for so long that this is never going to change, so to speak. But you actually said online a couple of days ago, you said nerves do have the ability to regenerate. There's this myth out there that once a nerve is damaged, that's it, and you can't do anything for it. But that's not what you're finding in your work, and that's really not what the research says either, right?
No, it doesn't. So obviously there's cases, right, Joe, where if someone has a complete spinal injury where it's completely severed or things like that, then, that is kind of its own separate thing. But when we're just talking about the generalized neuropathy, nerves are slow to heal. I tell my clients all the time, like, they're probably one of the slowest in the body to heal, but that doesn't mean that they can't. We just have to be able to provide an environment and provide them the tools that they need to start that healing and regeneration process. And I think a lot of this is people can get impatient sometimes, right? It doesn't happen quick enough. It doesn't happen fast enough. And so they're quick to kind of abandon ship, right? Well, that's not working. And like I said, it's that consistency over time where you're making those small changes and sticking with it that seems to have the biggest impact on the nervous system, right? And it's not just our diet. So obviously what we eat can cause more inflammation or can cause less inflammation. So we focus a lot on, what can we put in our body that's good? I like people to have a healthy relationship with food. I don't like to focus on what they're having to give up. Right? Because that creates that instant, like I call it the toddler reflex, right? Where as soon as you tell yourself you can't do something or can't have something, it's like, that's all you think about. That's all you want to do, right? You're going to dig your heels in. So I'm like, let's focus on what you can do. Let's focus on all the great foods you can add in, right? That are going to be healing. And it's funny because, the client I was referring to that's on the case study and even some of the others, once you start to feel better, and you associate certain foods with making you feel worse, you immediately don't want to feel worse. And so it's easier to make those shifts. It's that initial couple steps that tend to be hard. But the nerves really need very specific nutrients to heal. They are largely fat-based. So they need healthy fats. They need healthy proteins. They need the omegas. And I think that's where sometimes the disconnect can come in, because people think to eat healthy, they have to eat low fat, low carb, right? And so our nerves use glucose as a fuel source. It just has to be coming from a good source, right? So when we completely cut out fats and we completely cut out carbs, we actually are starving and depriving our nerves of what they need to heal and rebuild and improve themselves. So there's that. And then there's also the brain body connection that, it's how we think, it's how we focus, it's how we manage stress, because our nervous system responds to all of that, right? It's going to respond to stress. It's going to respond to a lack of sleep. So if you can't sleep, it's very hard to heal. And if you're super stressed, you're keeping that nerve system just kind of revved up with all the cortisol, and it's hard to let it kind of down regulate out of that super sensitive, overreactive mode, which is what we ultimately want to do for most of our clients, right?
The nutrition part is so important because you mentioned we have looked at fats as they're unhealthy, right?
Right.
Take them out of your diet. You shouldn't have fat in your diet, so to speak. And as you mentioned, our nervous system is about 60% fat.
Yep.
So if you want to provide your nervous system with an anti-inflammatory impact,
yep,
and you want to nourish those nerves so that they grow and heal and regenerate, fat's essential. And you mentioned the omega-3 fats are probably some of the most important ones that we should point our patients towards.
Absolutely. Yep. And like I said, healthy carbs. Carbs are not the enemy either, right? So, they need glucose. They need a certain level of glucose to function too. That's their main energy source. So we just don't want the unstable blood sugar, right? We don't want those big spikes and drops. But we do want to provide it with what they need to function. So, and then hydration, I think, is really key, because we can't flush out toxins. We can't remove waste around those cells, right? I heard this isn't my kind of analogy, but I heard an analogy by a colleague that said, you wouldn't want to just sit in dirty bath water. And when we don't hydrate and we don't, allow our body to flush toxins, it's like you have your cells just kind of sitting in their own waste. And I'm like, that's not healthy for anybody, right? It's definitely not healthy for the nerve cells. So we want to be able to clear waste, and we want to be able to move things, through so that they have constantly kind of healthy fluids around them, and they're able to get rid of the waste and metabolize appropriately, right? So,
Heather, if there are people listening, so maybe there is someone with diabetes who's had neuropathy for a long time, or there's someone who is just finishing up their chemotherapy treatment, and they're noticing that there have been changes now in their feet, and they're having problems walking and balance, but no one has really told them about these options. What is your advice to them?
Be proactive. Obviously, the sooner you can get in and make shifts and address it, the quicker and better the nerves are going to respond, right? The longer you let it go, I always tell people the healing process is directly related to how long you've had it. So the longer you've had it, the longer it's taken to recover. So be proactive and don't just immediately accept that status quo of, well, there's nothing you can do. Just, you're going to have to live with it. This is your new normal. Like, I hear that all the time. And so listen to your body and find, if you can find an integrative practitioner that you can work with, that is going to kind of help you work through the different nutrition and lifestyle shifts that would be beneficial for you, and kind of combine that alongside kind of those more what we consider traditional interventions. That's amazing. But then just the simple things like we just talked about, make sure you're getting enough fluids, make sure you're hydrating, unless you've got a medical reason why you can't consume, the appropriate amount of water. Getting enough water, making some simple shifts in your nutrition for those healthy fats, and stay away from processed, right? That's a big thing. Whether you're diabetic or a cancer survivor, processed sugar is super inflammatory. And so that's the biggest, I think in my program, they get the biggest wins or quickest wins of feeling better when they increase their water and they get that sugar out of their diet. Like, it's just such an immediate, like, the body just wants it out. So stay away from that processed sugar, substitute it in for some of those healthier options, and, lots of veggies and things like that.
Great. It's been great speaking with you today, Heather, about an integrative approach to managing neuropathy, both for people with diabetes, CRPS, And as you mentioned, chemo-induced neuropathy, really three important populations of people with chronic pain that are looking for solutions. Let everyone know how they can learn more about you and the work that you're doing.
So I have a website, like you mentioned. I know you said you would put that up. So Healing Essentials PT for physical therapy.com is my website. I'm on Facebook. I'm on Instagram, Healing Essentials PT. I have a community group. So if, clients are looking, it's an open community group. It's in a holistic approach to neuropathy. You can find it through the Facebook page as well. But it's just a great resource for people kind of coming in and wanting to learn more. So that community group is a great place for people to start. And then, like I said, I'm in Georgia. So I'm kind of in that North Georgia area. So I have a clinic as well.
Great. So we'll, of course, link to Heather's website, which is healingessentialspt.com. We'll also link to that free Facebook group if you're interested in joining that and integrating or communicating with other people with neuropathy, as well as Heather, to learn about what you can do. I'm Dr. Joe Tatta. It's been great speaking with all of you today and sharing this time with you. Make sure to share this episode with your friends and family on Facebook, LinkedIn, Twitter, Instagram. You can tag both Heather and I on Instagram. You can find us at drjoetatta.com, and we'll be sure to tag you back. Thanks for tuning in, and make sure to tune in next week, where we'll cover another topic on how to heal chronic pain. Take care.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit Integrative Pain Science Institute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.